Hello and welcome. My name is Justine Keefer, and I'm part of the long-term care working group that's been tasked with briefing senior ministers for the upcoming meeting with the federal government regarding long-term care and COVID-19. Our briefing today is concerning the creation of national standards or federal funding for long-term care facilities as they've been hard hit by COVID-19. We viewed this problem as an opportunity to provide solutions that not only better our long-term care system, but also work as a way to give money back to Albertans so they can make their own health choices and shift towards aging in place programming. We've also stressed the need to negotiate a fair deal for Albertans, which is based on the strategy created by our Premier, which is working to get the best possible fiscal deal out of Confederation. We've identified risks that focus mainly on Alberta Health Services Union, AUPE, their reactions, as well as possible reactions from the federal government, as Alberta's position historically has not been interested in national standards or needs-based funding. So this means in terms of a national strategy, we do have lines that we'll draw in the sand for what we'll accept. So keeping these issues in mind, our group has identified 3 solutions that address the identified problem and purpose and provide a recommendation for the Ottawa delegation. In regard to implementation, our own internal programs of the Health Quality Council of Alberta and Alberta Health Services will provide oversight of the effectiveness of the proposed solutions. So to briefly introduce our group, we are made up of Nick Carlson and Rebecca Phillips from the Continuing Care Health Service Standards and Accommodation and Licensing Unit, Ben Angus from the Intergovernmental Relations Unit, and myself, Justine, from Indigenous Health Policy, all from within the Ministry of Health. So our presentation today will follow the agenda here for your brief look at, and then beginning with purpose, as discussed prior, which will be to brief senior Ministry of Health officials traveling to Ottawa on Alberta's stance on national long-term care strategy and provide alternative solutions. I'll now hand it off to Rebecca, who will go over key background information.
Thank you, Justine, for outlining why we're here today. We'll begin by showing COVID-19 related statistics within Alberta and then as a comparison to other provinces. Following that, we will set the scene by outlining the long-term care facilities within the province and how they are regulated through Alberta Health Services. So looking at up-to-date COVID-19 statistics for Alberta, there are currently 4,887 active cases and 1,805 total deaths. And then moving on to a comparison of long-term care deaths from August 2020 statistics, which is the most recent report on long-term care deaths that we have access to from all jurisdictions, we see that Alberta ranks below Ontario, Quebec, and British Columbia in the percentage of long-term deaths, which is at 67% within the province. At this time, we can update Alberta's long-term care deaths, and while the number is not provided on the slide, we have recently received an update. So currently there are 1,173 deaths, which is at 65% of deaths in Alberta. So while long-term care deaths are still an issue that needs to be addressed in Alberta, comparatively it is less acute in Alberta than it is in other provinces. So in terms of long-term care, Alberta has a differing makeup of publicly versus privately funded long-term care facilities. In Alberta, there are fewer facilities and both the public and private owners are almost like equal standing on operation within the province with slightly higher number of privately funded facilities. This is in contrast to Quebec, which is heavily publicly owned, and Ontario, which is heavily privately owned. So as a reminder, provisions have been implemented to protect staff and residents of long-term care facilities. Most of these provisions have been implemented to reduce transmission, and the first of these were to create restrictive measures within facilities, which include lockdowns for facilities with outbreaks, isolation for residents who have symptoms or have tested positive for COVID-19, and limitation of 2 family members to limit contacts for residents. And further measures to reduce transmission include long-term care staff being limited to only working in one facility, increased funding to mitigate the increased operation costs for PPE, staffing, and cleaning supplies, and the implementation of rapid testing for asymptomatic long-term care staff. And all these measures have been implemented to reduce the transmission within long-term care facilities and serve to keep both residents and staff safe. So now, as a final update on vaccine rollout, as part of phase 1, which is on schedule to be completed by March 2021, AHS is on track to vaccinate all long-term care residents and staff regardless of age. So as a final reminder, Alberta is unique in the high level of provincial standards for accommodation and health services for Albertans. With an operating budget of roughly $1.2 billion dedicated towards continuing care, AHS is positioned to meet the needs of all Albertans as they age. Additionally, AHS continues to monitor and report on elements of our healthcare system in both private and public facilities, and work alongside the Health Quality Council of Alberta, which connect us our reporting mechanism back to Ottawa and, most importantly, to Albertans. These unique standards and regulations have benefited Alberta's long-term care facilities during COVID-19 and helped mitigate the risks. However, there is still a need for improvement within long-term care facilities to provide high-quality health and care services for Alberta's seniors during and after the pandemic. And an increase in funding, which will be outlined in our solutions, will be able to allow us to improve our care for seniors in Alberta by transitioning to at-home care. I will now pass our brief over to Ben, who will outline our solutions to improve the care for seniors in Alberta.
Thank you, Justine and Rebecca, for providing a background and context as we move into the policy and implementation solutions for the briefing today. So before going into details on the specific solutions, we want to reiterate the fact that the solutions provided today are focused on ensuring that there are no new needs-based funding models and instead advocate for increases in pre-existing funding models. Additionally, the policy solutions that you'll be seeing have been crafted in consultation with the Ministries of Seniors and Housing and Treasury Board and Finance to ensure that the solutions that we do present are feasible and tangible in terms of implementation and needs of Albertans. And lastly, we also want to ensure that we applied a GBA plus lens to the solutions provided, recognizing that the majority of long-term care facility workers in the province either identify as female or come from a minority background or a combination of both. We want to ensure that the policy and implementation outlined today responds to those unique needs. So we'll move on to solution one, which looks at providing an direct financial contributions to Albertans and specifically individual contributions to seniors to help facilitate a transition from long-term care to an aging in place strategy. This not only represents a cost-effective solution, but also meets the needs of aging Albertans. So specifically, by increasing old age security at the federal level, we will be able in time to phase out the current Alberta Seniors Benefit. Now, just as a reminder, Alberta is unique in the fact that they do provide an Alberta Seniors Benefit, which essentially works as a top up to the federally provided old age security. So by having the federal government increase old age security payments, we'd be able to save Albertan taxpayer dollars and ensure that the federal government is paying their fair share in their jurisdiction. Aside from being a cost-effective solution, we also want to ensure that we can provide a variety of solutions for Albertans as they continue to age. As we've seen during COVID-19, popular opinion has showed that there is a demand and a desire to have alternative solutions outside of long-term care for seniors as they age. By providing an increased old age security, we hope that this would limit some financial barriers and allow seniors to consider aging in place as an alternative option. Additionally, this option limits the strain on the demand for spots in LTC facilities in the province, both private and public. Currently, there are extensive wait lists for private and public LTC facilities in the province, and by transitioning to an aging in-home policy, it is our hope that this would free up some space in current LTC facilities and ensure those who do require extensive 24-hour care or higher than average care that could not be met at aging at home have quicker access to LTC facilities if needed. And then lastly, just to reiterate, it does represent a fair deal by asking the federal government to step up in a jurisdiction where we have been uniquely footing their portion of the bill. So we'll move on to solution two that we would also like to present. And this one looks at increased funding through the Canada Health Transfer. So for background context, this type of solution has been previously discussed at the First Minister level, specifically in a November 2020 release by the Council of Federations. And given that the Council of Federations does work within a consensus-based decision-making model, we believe that this solution would be palatable by all provinces and territories if we were to move away from a national strategy implementation. It provides a balance between maintaining provincial authority over health jurisdictions, something that Alberta takes pride in given our faith and reputation with Alberta Health Services, while also ensuring that the federal government plays a larger financial role in tackling COVID-19, which is a sentiment that we've seen expressed by other premiers as well. So in terms of the recommended solution we would like to present to you, We would actually encourage that the Alberta delegation advocate for a combined approach between solution 1 and 2. And this combined approach advocates for the increase of old age security while also ensuring a top up to the Canada Health Transfer System. So the reasoning that we would advocate for a combined approach is that it really, first of all, allows us to facilitate a transition away from the institutional LTC model. By increasing old age security payments, it provides additional financial stability for Albertan seniors, as we had previously discussed. But the additional Canada Health Transfer top-up can also ensure that we can provide short and medium financial solutions to long-term care facilities through the monitoring of Alberta Health Services, as well as and rebalancing the Canada Health Transfer per healthcare funding continues furthering this notion of having an Alberta fair deal. And we've also been, to satisfy a GBA plus lens, we are also open to instituting a training program that helps offset potential job loss that we could see from transitioning away from LTC to aging at home. So now we'll transition to Nick, who will provide more details about how we would implement our solution.
Hey, thank you very much for that, Ben. So getting into some of the details on implementation here, we'll start with HQCA, which is able to gather and analyze information and assess the performance of long-term care in order to highlight what is working and what isn't. Now, this organization works in collaboration with AHS and Alberta Health, and it's been working very well with some rooms for improvement. Now, if provinces would like to pursue an integrated model similar to how Alberta does, we do want to extend the sentiment that they could ask Alberta for some expertise to be shared about how AHS works and how integration has fared for Alberta. And as for how this solution furthers fair deal recommendations, we want to touch upon how it is able to promote equal opportunity, further economic development, as well as essential services, while also preventing federal spending in provincial areas and resisting government intrusion in areas of health and social services. And touching on the OAS aspect of this, it does, within the OAS, it asks people to consider personal circumstances when applying for OAS. And we want to underline within this that everybody is going through exceptional personal circumstances due to COVID-19, requiring this amendment. So through this, we believe that temporarily alleviating the residency of 40 years, needing to be a Canadian resident for 40 years, down to 20 years would help increase the amount of coverage for seniors who need this care, while at the same time keeping the 65-year and $77,000 repayment for income level. Additionally, we believe that it is within the federal government's purview to address non-OAS recipients as well as Indigenous seniors and how they are faring with this pandemic and long-term care. And further, we'd like to echo, as Ben first touched upon, the Council of the Federation's Rebalancing the Healthcare Funding Partnership meeting, in which all premiers called for a rebalancing of the healthcare spending, as currently provinces are taking on 78% of healthcare spending, while the feds only spend 22%, which should be a 50-50 split. And as was touched upon, this was supported by all provinces on consensus. Now, money that would be spent through these increases in funding can be divided into shorter and longer term goals. Shorter term being increased hiring for staff in homes while we do this transition from long-term care towards home care. And longer term could be transitioning staff and resources towards more mobile and home care solution, renovating current long-term care that may need renovations, as well as boosting AHS's budget. And we would also just like to further emphasize how this growing healthcare spending imbalance cannot be sustained as the provinces emphasized. And this represents a holistic approach where OAS is able to act as a sort of needs-based opportunity via actually directly funding seniors who need this money, and CHT can still be defending the per capita aspect that Alberta benefits from. Now moving into identifiable risks here. So AUPE, currently, we did discuss the possibility of a retraining program, which would include that GBA plus element. And we also would just like to bring up that their bargaining unit, which is a collective agreement between AUP and AHS, will be up for renewal, and we think that you should be aware of this. Some potential short-term risks with this are the availability of long-term care beds. And this is an area where we believe in the short term, private providers could step in and increase spots by converting new spaces. And there are also, as part of the Fair Deal report, we do want to talk about how Alberta is investigating leaving the CPP for a provincial program. However, questions about Alberta's role with the CPP will be addressed later in the future, and it's not immediate. And with that, I will hand it over to Justine for the conclusion of our brief.
Thank you, Nick. So in discussing risks, we've also identified major stakeholders and their anticipated responses. We've crafted ministerial responses to help alleviate concerns. Some of the stakeholders identified include AHS, their union, the federal government, Indigenous communities, other provinces, and private long-term care facilities. We would be happy to answer any questions you have about these in the questions portion. So we further identified key messages should the minister need. These are focused on emphasizing the economic benefits of the proposed recommendation, which would put money directly back into the pockets of Albertans. This would also save money long-term, as keeping someone in aging in place costs less overall. This also includes formulating the problem in terms of the unfair deal seniors in Alberta have been getting, as they have contributed more to federal programs than they've received back. Emphasizing that Alberta is okay with other provinces pursuing provincial standards is important as well, but so is the fact that Alberta is more than confident in their own standards and is not willing to negotiate to national standards or agree to needs-based funding. In sum, our solution to advocate for both increased CHT funding and an OAS top-up is the best way to ensure Albertans get the fair deal they deserve, while addressing concerns around long-term care facilities and the impacts of COVID-19, and encouraging a transition to aging in place programming. We'd now be happy to take any questions you might have.
Well, team, thank you very much for a very interesting and original presentation. So there's lots to talk about here. I'll start with Susie McDonald, then Janine, then Ronelle.
Well, thank you for this excellent presentation that I think really is at the heart of what Alberta is all about. And I love that you've built in the Fair Deal panel for sure. One of the things that we struggled with recently, of course, is that Ottawa is not willing to give us really anything. We look at stabilization. Even when we had agreement from other provinces, they wouldn't come on board. I'm just wondering if you've thought through, and I see it here a little bit in your messaging, but if you could just dig a little deeper for me on what some of the bottom lines are. If we had to give something in this context, what would that look like?
Yeah, of course, I can jump in and start on this. So our bottom lines for this are twofold. So we will not be wanting a needs-based funding, as that doesn't benefit Alberta since we do have a younger population. Now, this population will eventually need to be taken care of. So that's why we do still like the per capita funding basis, and that's where our line is with that. And further, I can hand it over to one of my colleagues to address the other aspect that is our line in the sand.
I'll take that. Our other line in the sand is national standards. We believe that, we believe that we already have high standards. We fared a lot better than other provinces within long-term care facilities, and we have that integrated system that's unique, and we are happy enough to work with other provinces and shared with them the details that we have. But in terms of national standards, we believe that any standards that would come into it would already meet the standards that we have. And furthermore, we are accountable to Albertans, not to Ottawa. So coming from that, it should be our standards that we put in, because it's our facilities and our taxpayers' money, and we're accountable to Albertans.
Okay, thank you. Let's go to Janine and then Ronelle.
Thank you very much for your presentation, and I'm going to build a little bit on my colleague's question. We have shown that we're willing to cooperate both with the federal government and across the Federation in other areas related to national standards. In pre-COVID times, for example, Alberta was leading the charge in reducing regulatory barriers to interprovincial trade and showed itself a leader at interprovincial tables willing to talk about national regulatory frameworks in key economic areas. So when we go to Ottawa and we say that when lives are on the line, we're not willing to talk about national standards, and Ottawa looks at us and says, but you were willing to do it when it put money in the pocketbooks of big companies, what are we going to say to them?
Okay,
I think that, really emphasizing the jurisdictional responsibilities between federal and provincial is what we're really stressing here, that provinces are responsible for the health of their citizens. So just emphasizing this notion that we're responsible for Albertans. The federal government can provide support for us, but in terms of our citizens' health, that's in our purview.
Just to add on to Justine's point as well, I think in terms of messaging that we would provide to the federal government when it comes to lives on the line compared to providing funding to big companies, I think there is a bit of a precedent to kind of supplement this messaging. A good example would be the $1,200 wage top up that's been recently announced. And this was part of a larger COVID economic benefit that was provided by the federal government, but the provincial government saw it fit to make sure that any restrictions or ties attached to this funding were acceptable within an Albertan perspective before we provided that funding to Albertans. So in terms of having that conversation with the federal government about lives on the line, I wouldn't necessarily say it's an absolute, we're not willing to make any type of sacrifices when it comes to these lives on the line. But I do think we also recognize that the federal government has their own responsibility to ensure that funding still makes its way to Albertans. So even if we were to either have limited negotiations or none at all, there still would be a precedent for the federal government to still ensure that the lives of Albertans, or from the federal perspective, the lives of Canadians, are still taken care of during the COVID pandemic. And additionally, in terms of any supplemental messaging, this can certainly be something that's discussed either with the press secretary or the chief of staff for the Minister of Health as they prepare for the delegated meeting to Ottawa, as this is likely partially a partisan conversation as well.
Okay, let's go to Ronelle.
Thanks, colleagues, for that. Some good policy options that you put on the table here. Just one quick question and just a clarification on my part here. In terms of some of the OAS top up, I guess I was just curious as to had we considered or run sort of what the amount we'd be looking for from the federal government on that, just to put some in perspective. And I guess offset to that, great note on the identifiable risks with respect to some of our discussions on Fair Deal and CPP. And so just wondering around the risk mitigation there, did we run sort of what that was on a maybe even a dollar value? Just curious as to your thoughts on that.
I can start by answering. So in terms of providing a specific dollar amount for OAS, from my understanding, and I unfortunately don't have the specific number, but I believe the maximum an individual could receive on OAS is $613.57, give or take. And recognizing that the amount is attached to inflation and I believe has the potential to fluctuate every 3 or so months, we had generally mentioned an idea of an increase to $800 a month, although we recognize that would be a relatively steep increase. However, there's also no harm in our opinion for asking for a bit more, considering how much Alberta has been paying in the past. So in terms of when we talk about specific numbers for OAS, I think this is definitely an opportunity as well, where we can include some of our interdepartmental partners, specifically those from Treasury Board and Finance, who will have a much deeper understanding of what the budget implications would be. In terms of the second portion of the question about the Canadian pension plan and what type of ramifications that would have if Alberta were to pursue a more formal path of essentially implementing a provincial plan, I think for the time being, at least, because there is nothing set in stone at the time being, I think it would be smart for Alberta to continue at this time to advocate for this OAS top up, even though there is the potential for a Canadian pension plan withdrawal. While there is no set date, there still is the potential to have that increase in financial federal funding. And given the gravity of the COVID-19 situation and the sensitive time around it, even if Alberta were to hypothetically withdraw from the CPP, that would be years away at least. And so in the meantime, at least having this OAS top up and the slow phase out of the Alberta Seniors Benefit, it would provide a direct and much needed financial boost for seniors. And then we can work out the logistics of a CPP withdrawal with intergovernmental relations and other
Ben, I'm going to
partners.
cut you off just now, just so we get another question in here. And I'm going to follow up directly on what you've been talking about, though. If I understand your presentation correctly, you want the feds to increase the OAS benefit to seniors. And at the same time, the province will take away its seniors top up. So if I'm an Alberta senior, it doesn't, I don't come out ahead. But the second thing is what you're basically saying, if I understand it, is that we want the burden and the challenge of funding long-term care in Alberta to be borne by individual seniors as much as possible. And what I'm wondering is, how do you sell that notion to the other provinces that we've got to deal with? Like, because the feds are not just going to do it for Alberta seniors. There's no such thing really as an Alberta senior. There's a senior. So there's my question to the team. How do you sell this notion to the other provinces?
So I think to begin, I guess stressing, we discussed as a group, and we tried to present in the presentation, the idea that the federal government might not agree to both the CHT increase as well as the OAS top up. So in discussions trying to get other provinces on board, we did discuss with the OAS top up that it does move towards benefiting provinces with more seniors, right? Because it's going directly into the pockets of seniors. So we figured that would be the sort of messaging around that in order to get provinces on the line. But I'm not sure if one of my group mates wants to jump in with something else.
Yeah, for sure. And as for the Alberta Seniors Benefit, we do want to stress that we are the only province that does offer this. Yeah. So going back to a federal funding would just be a return to what this kind of is expected to be across all provinces. And we also think that stressing to other provinces that governments that are administering these services should be the ones in charge of determining the standards of these services. Since healthcare is a provincial responsibility, we believe that this would be something that would be in the interest of other provinces as well.
Okay, let me just go to Steve Orsini. I want to get as many questions in as we can. We're very interested in your proposals. Steve, go ahead.
Yes, thank you very much. I really enjoyed the presentation and how you built in Alberta's fair deal. I'm just thinking, if the federal government is really trying to achieve national standards and some other provinces start to acquiesce and they go to bilateral agreements, what will Alberta do? Would they, continue to take this position of no national standards? Would they move to, if our standards are better, we can use the federal standards as a backstop? What would your advice be to the Premier and to the Minister, that if other provinces started to capitulate and start signing individuals one-on-one deals?
So if there is sorry, was there something you would want to add?
Go ahead, you go ahead.
Okay. So if there was a situation that you had described where we see a type of bilateral agreement, let's say, for example, with the Atlantic provinces and the federal government, I think in that type of situation, Alberta would be suited to walk away from the discussions about a national standards. And if the conversation were to go in that direction, I think Alberta would be relatively confident that we would have other provincial partners in a similar position. Take, for example, Quebec. They've expressed a very similar statement about not wanting federal standards applied onto their health systems, but rather almost similar notions attached financial contributions. So if the conversation looks like it is going towards a more formal bilateral agreement, I think in that case, Alberta would be inclined to walk away with other provincial partners from the table. And that could essentially restart conversations about what the best approach would be.
Okay, Janine, back to Janine. Go ahead, Janine.
Thank you. I'm just concerned that what if walking away means no money attached whatsoever for Alberta? What do we do for Albertans in that case?
I think we believe that in this case, the federal government wouldn't end up leaving money on the table if we were to walk away. So opting out with the choice of funding would be the preferred solution with this, so that we can still achieve funds, but be able to use them the way that we see fit.
So the bottom line is basically we want to get some more federal money, but we have real confidence in the quality of our system and our standards, and therefore they should give us the money and leave us alone. Is that a clear bottom line?
Precisely.
Okay, well, look, this has been a most interesting and imaginative presentation, colleagues. So we want to thank you most sincerely. This is really interesting.